Good morning, everybody, and welcome to this wonderful venue and to the 15th World Congress on Public Health. I'm Helen Keleher and I'm Congress convener, and I can't tell you how exciting it is to be here after so much planning, so welcome. First, I'd like to acknowledge the traditional owners of the land on which we meet today, and we look forward to Auntie Joy Murphy's formal welcome to country shortly. But I've just got a few things first that I want to put onto your thinking. But I would also like to acknowledge that this event has been many years in what we've called the curating, really. It started with an email in 2012 from the Melbourne Convention Bureau, thank you Bev, who said, there's this event, you're the president of the Public Health Association, perhaps you'd like to think about putting in a submission. And I'd been wanting the Public Health Association of Australia to look beyond our borders, to be more involved in the global public health scene, because as you know, disease and poverty and poor health know no borders, and we do need to work together as a global community. So it didn't take a lot of persuading for me for the Public Health Association to agree to put in the bid. And really, the rest is history. We won. The year of the Congress was brought forward by a year, just to add a little bit of pressure. But that also means that we're celebrating, of course, the 50th birthday of the World Federation of Public Health Associations, which is a fantastic milestone you'll hear more about during this Congress. The set design, folks, is what we're about, transforming our world through the Sustainable Development Goals that we all work towards. They're about ending poverty, protecting the planet, reducing inequalities, increasing gender equity, and so on. You should all be able to recite them in your sleep by the end of this Congress. Through the next few days, we'll be honoured by the attendance of many dignitaries, and today I'd like to acknowledge that we're joined by senior World Health Organisation representatives from various offices, particularly Geneva, and we're so grateful that you're here with us today. Public Health Association leaders from around the world, World Federation Office, obviously staff and leaders, but particularly today we're honoured by the presence of the Federal Minister for Health, the Honourable Greg Hunt, also the Minister for Sport, and for Victoria, the Honourable Martin Foley, who's the MP for this seat of Albert Park and has a huge portfolio, I don't know when you sleep, Martin, mental health, housing, disability, ageing, equity and creative industries. So we look forward to hearing from you both shortly. So on behalf of the National Organising Committee, a wonderful group of people who've worked so hard for the last 3 years, we welcome all of you, all our official guests, our speakers, sponsors, exhibitors and delegates to this Congress. You are most welcome, and I look forward to meeting as many of you as possible over the next few days. The biggest challenge you will have until Friday is actually deciding what to go to, because we have 17 keynote speakers, 23 World Leadership Dialogues or Symposium, 36 panels, 28 workshops, 124 oral sessions, 4 storytelling sessions, and hundreds of posters. It's going to be absolutely amazing. We will be doing some content capture, which means that we will be videoing all the main plenary sessions and the World Leadership Dialogues that are held in these halls. We will need some funding to do some editing on them, post-production work, to make sure they're suitable to go onto the websites of our partner organisations, but it does mean that we can share what we've heard with all your colleagues around the world. We've got a very strong equity theme running through this whole Congress, and we know that not everybody who would like to come can come. So we want to share those learnings using digital platforms that are now available to us. In your satchel, you'll find this gorgeous little program booklet, which is an easy-to-use guide for your sessions. But all the abstracts are on the app, another digital platform that we're able to use now. It's free on the App Store. If you haven't already downloaded it, please do so. And this is where you'll get alerts and updates. Now, I know that the public health community is often on steroids on social media, so you Twitter away, everybody. Here are our handles and hashtags. We want you to use them at Public Health Association congresses and population health congresses with our partners in the past. We've trended, and we hope to trend every day this week. If you need assistance with anything, we've got 100 enthusiastic student volunteers studying public health or medicine. They're wearing blue t-shirts and they'll be here throughout the Congress. Plus we have the wonderful team from ICMSA, our conference organisers, who are available around the building, but particularly at the registration desk. All our media is being managed by Science in Public, a great team of science journalists who are working to ensure that your research and our messages reach far and wide, and already that's happening. You may have noticed the birdcage downstairs on the exhibition level, well, it's actually upstairs from here, where a lot of media interviews will take place. It's looking fantastic. Now, just the boring housekeeping things. Please keep your personal belongings with you at all times. This is a public space and we don't want anything going missing. If there is an emergency, please follow the instructions of the Melbourne Convention Centre staff who you can see around the building at all times. The posters, I just want to mention, are all digital. We're trying to save trees by not having posters carried around by people. They'll be on level 1 at the poster stations where there are big monitors set up, and you'll be able to see the schedule for those during the lunchtime breaks on the app. There will also be constant screenings of videos of the World Federation of Public Health Association history, its achievements, past presidents and so on. They'll be on loops on those monitors throughout. We're not having a conference dinner, folks, we're having a party. We're having a party down on South Wharf in marvellous Melbourne, which is just around behind the Melbourne Convention Centre at 6:30 tomorrow night. It's going to be fantastic. We're on the river with the lights of the city behind us. There'll be pop-up entertainment and brilliant food and drinks, of course, of all types. It doesn't require a ticket. It was included in your registration. If you no longer wish to attend, please just hand your ticket back at the registration desk so we can confirm numbers. So we had many wonderful Congress partners who've been working, as I said, to bring this Congress to life. And these are partner organisations who've worked together before in Australia to bring population health congresses to fruition. The Public Health Association of Australia, the Public Health Association of New Zealand, the Australasian Faculty of Public Health Medicine, the Australian Epidemiological Association, the Australian Health Promotion Association, and the Australian Women's Health Network. And I'd also like to thank our many sponsors for their support, because without that, this Congress would not be possible. So a big thank you to the Australian Government Department of Health, the Melbourne Convention Bureau, and the Victorian Department of Health and Human Services, the Victorian Health Promotion Foundation, Parks Victoria, Victorian Department of Environment, Land and Water Planning, Business Events Australia, the City of Melbourne, Deakin University, the Royal Life Saving Society of Australia, and Oxford University Press. I hope I haven't missed anybody. The Black Dog Institute I did miss, sorry about that. A late comer onto our scene, but very much appreciated for one of the World Leadership Dialogues. So please ensure that you take the time during the breaks to meet new colleagues, visit the exhibitions, and make the most of your time with us. It's going to be a truly wonderful event.